You know that moment when your usually laid-back golden retriever starts gulping down water like they've just crossed the Sahara?
Or maybe your cat, normally a bit picky, is suddenly starving, but, well, still seems to be losing weight.
Exactly. It's easy to just think, oh, they're just having an off day.
Right. But sometimes these little changes can be surprisingly significant.
And that's exactly what we're diving into today. Hyperglycemia in our beloved cats and dogs.
That's right. We've sifted through some, pretty in-depth medical information to bring you the crucial insights.
Our goal here is really to understand what's going on when their blood sugar gets too high.
Yeah, what are the key warning signs you should be aware of? And ultimately, to give you clear, useful knowledge without all the confusing medical jargon.
Okay, let's get right to it then. Hyperglycemia. Very simply put, it's just too much glucose, too much sugar circulating in their blood.
Think of it like a traffic jam of sugar in their system.
A sugar traffic jam? I like that. Now, the reasons behind this jam can be quite different, can't they? Depending on if it's a dog or a cat.
Oh, definitely. What's really interesting here is the difference in, the root cause often. In dogs, high blood sugar is frequently because their body isn't making enough insulin,
Oh,
or the insulin it does make isn't working as well as it should. It's kind of a production problem.
right, production issue. And cats.
With cats, it's often more about their body cells not responding properly to the insulin that is being made, insulin resistance.
Ah, so the insulin's there, but the doors aren't opening for the sugar.
Pretty much. Even if their body's making insulin, it's like the cells have, stopped answering the door to let
Yeah.
the sugar in. And this is often coupled with some changes in the pancreas itself. Pancreatic amyloidosis is common in cats.
So different initial problems, but they land in the same place. High blood sugar. But it's not always just treat for diabetes, is it? Our sources mention other potential causes.
Absolutely. This insulin resistance, where the cells aren't responding effectively, that can also be triggered by various hormones floating around.
Like what kind of hormones?
Well, things like growth hormone or even certain medications. Corticosteroids are a big one.
Steroids, right. I've heard about that link.
Yeah. And also the liver, that amazing multitasking organ, it can start pumping out more glucose in response to stress.
Especially in cats, I gather.
Particularly noticeable in cats, yes, due to adrenaline release, or it can happen as part of conditions like type 2 diabetes.
And this extra sugar just floating around.
Mm.
It's not harmless, is it? Our information points to several body systems getting affected.
No, definitely not harmless. If we connect this to the bigger picture, the endocrine system managing hormones like insulin and the metabolic system dealing with energy, they're obviously central.
Makes sense.
But high blood sugar can have these ripple effects. For instance, it can impact the nervous system.
How so?
In really severe cases, the high concentration of sugar in the blood can actually draw water out of the central nervous system. Dehydration, essentially.
Right.
And what's also quite specific to cats is they can develop this weakness in their hind legs. You might see a really distinctive flat-footed stance.
Flat-footed, what does that look like?
Their whole foot, the hock touches the ground when they walk or stand. The medical term is plantigrade stance. It's due to nerve issues, neuropathy, linked to that high blood sugar.
Plantigrade stance. That's a really specific and concerning sign of nerve damage in cats then? What about their eyes and their, drinking and peeing habits?
Good questions. Persistent high blood sugar can indeed affect the eyes. In dogs, it's quite well known for leading to cataracts.
Cataracts. So
And regarding urination, well, when the glucose level in the blood gets above a certain point that the kidneys can handle,
the kidney threshold.
exactly, the excess sugar starts to spill over into the urine, and sugar, it attracts water.
Osmosis, right?
Right, so it pulls more water into the urine, leading to increased urination polyuria is the term.
Which then makes them thirsty.
Precisely. That makes the animal feel more thirsty and drink more polydipsia. It's interesting, too, that kidney threshold for reabsorbing glucose, it's actually higher in cats than in dogs.
Huh. So a cat might have higher blood sugar before it starts showing up in their urine compared to a dog.
Potentially, yes.
Okay, so if you're noticing your pet suddenly drinking and peeing a lot more, that's definitely something to, pay attention to. What are some other early signs owners might spot?
Yeah, it's important to remember the signs can vary quite a bit, and especially if the high blood sugar is temporary, maybe stress from a car ride or medication, you might not see any obvious changes at all.
Right, not always obvious.
But if we look at what owners often report historically, Dogs in the early stages might show that increased thirst and urination, sure, but also maybe some depression, unexplained weight loss.
Even if they're eating well.
Sometimes, even if they have an increased appetite, strangely enough, or sometimes they might be overweight initially, particularly with certain underlying conditions.
Increased appetite and weight loss. That sounds counterintuitive.
It does, doesn't it? But it happens because their body isn't able to effectively use the glucose for energy, even though there's tons of it in the blood.
So they feel hungry, eat more,
Yeah.
but the energy just isn't getting into the cells.
Exactly. Now, in cats, the picture can be a bit different. You might see obesity, actually, especially with type 2 diabetes,
Okay.
and that plantigrade stance we just talked about. Also, maybe a decrease or even complete loss of appetite, sometimes vomiting, diarrhea, and just like dogs, that increased thirst and urination.
So loss of appetite is more common in cats with this.
It can be, yes. And in very severe cases that go untreated, both cats and dogs can get really dull, mentally depressed, even progress to a coma. That's due to the extremely high blood sugar and the increased concentration of stuff in their blood hyperosmolarity.
Those are some pretty serious developments. Are there things a vet might pick up on during a physical exam? Clues.
Absolutely. Although a physical exam could also be completely normal, especially early on.
Okay.
But there are often clues. Obesity, particularly in cats, is a known risk factor for type 2 diabetes. That flat-footed stance in cats is another key thing a vet would look for.
Right, the plantigrade stance again?
In dogs, they might notice those cataracts forming in the eyes. On the flip side, in dogs with type 1 diabetes, you might see noticeable weight loss, maybe a very thin body condition.
Okay.
Sometimes the liver might feel enlarged when the vet palpates the abdomen, and unfortunately, pets with long-standing high blood sugar can be more prone to chronic infections, and they might just have a dull or poor quality coat.
Lots of potential signs then. Subtle and not so subtle. So we've covered what hyperglycemia is, how it might show up. Let's really dig into the causes. Our sources listed quite a few potential culprits.
Yeah, it helps to think about these causes in categories. Sort of. We've already talked about the main insulin-related issues. Type 1 diabetes, not enough insulin production, mostly dogs. And type 2 diabetes insulin resistance, more common in cats.
Okay, 2 types of diabetes.
Right, but that insulin resistance category, it includes more than just type 2 diabetes in cats. Several hormonal disorders can cause it too.
Like Cushing's?
Exactly, Cushing's disease, where there's too much cortisol, or acromegaly, which involves too much growth hormone. Both can interfere with how insulin works.
Interesting.
And interestingly, high levels of progesterone in female dogs during their heat cycle can cause temporary insulin resistance.
Really? During heat?
Yep. Also, underlying kidney problems, even urinary tract infections, believe it or not, can sometimes contribute to insulin resistance.
Wow, that's a really broad range of potential underlying issues. What about things that might cause just a temporary spike in blood sugar?
Right, the transient stuff. Physiologic changes are important, just like us, blood glucose goes up naturally after a meal.
Post-meal bump.
Exactly. And stress, as we mentioned, especially in cats with that adrenaline surge, can cause a temporary spike. Then there are medications.
We mentioned steroids. What else?
Certain types of diuretics, morphine, intravenous fluids that actually contain dextrose or sugar.
So fluids themselves could be an issue.
If they contain dextrose, yes. Also, certain hormonal medications like progestins, growth hormone therapy itself, and of course those corticosteroids we keep mentioning.
It really underlines how important it is to tell your vet everything your pet is getting, doesn't it? Supplements, too.
Absolutely crucial. And even in pets already being treated for diabetes, we can see high blood sugar if things aren't quite right.
Like what?
Could be diet-related. Feeding diabetic cats a diet that's too high in carbs, for instance. They generally do better with high protein, low carb.
Okay.
Or issues with the insulin itself, wrong dose, wrong timing, maybe problems with how it's being given or stored.
Administration issues.
Yeah, and rarely there can even be this rebound effect where blood sugar spikes after it's gone too low, the Smoji effect.
Complex.
Also, if a pet is getting nutritional support intravenously, like TPN, those solutions can sometimes raise blood sugar. And, we should never discount the possibility of a simple lab error.
Right. Always a possibility. So, are there specific types of pets or situations that put them more at risk for hyperglycemia?
Our sources definitely highlight a few key risk factors. Stress is a big one, particularly for cats, likely because of that adrenaline effect.
Makes sense.
If a pet has other underlying health conditions, Cushing's, acromegaly, Acute pancreatitis, inflammation of the pancreas, they're at higher risk.
Okay. Coexisting diseases.
Certain medications, especially steroids and progestogens, and as we touched on, getting those intravenous fluids containing dextrose.
Okay, so if a pet is showing some of these signs, how does a vet figure out if hyperglycemia is the problem and what's causing it?
Well, the first thing a vet often considers, especially if it's a cat and the reading is only mildly high, is stress. Was the cat super stressed by the vet visit?
Right, the white coat effect, but for cats.
Kind of, yeah. So if the initial blood glucose is only moderately up and there isn't a strong history of excessive drinking or urination, the vet will likely want to repeat the blood glucose test after the pet has fasted, usually about 12 hours.
A fasting blood glucose, okay.
And they might also recommend a fructosamine test.
Right, you mentioned that.
Huh.
What exactly does that tell the vet that the single glucose test doesn't?
Good question. So a single blood glucose test is just a snapshot right now, that exact moment.
Okay.
The fructosamine test gives a longer-term picture. It reflects the average blood glucose level over the previous, say, 1 to 3 wints.
How does it do that?
It measures glucose that's attached itself to proteins in the blood over time. So if the fructosamine level is normal, it strongly suggests that a single high glucose reading was probably just a temporary spike, like from stress, and not persistent hyperglycemia like you see in diabetes.
Ah, okay, so it helps differentiate stress from true diabetes.
Exactly. It's a really useful tool for that.
And what other things do vets need to think about when they're looking at these blood tests for glucose?
Yeah.
Lab stuff.
Yeah, several factors can mess with the readings. We mentioned drugs like steroids or dextrose fluids can artificially raise glucose.
Right.
Also, the sample itself. If the blood sample is really fatty lipemic, or if the red cells have broken down hemolysis, or if it's yellow from jaundice icteric, these can sometimes interfere with the machines depending on the method used.
Okay, sample quality matters.
Hugely. And getting the serum, the liquid part, separated from the red blood cells quickly is vital. Ideally within an hour.
Why so fast?
Because the red blood cells keep using up glucose even after the blood is drawn. If you wait too long, you'll get a falsely low result.
Oh, okay, got it.
And while those handheld glucometers people use can be helpful for home monitoring after diagnosis, the initial diagnosis should really be confirmed with lab tests validated for animal blood. They can read differently.
Good point. And the test strips need whole blood. Right. And measured quickly.
Yes, whole blood for the strips, and ideally test within about 30 minutes of getting the sample.
So proper handling is just as key as the test itself.
Well,
What about other standard tests, like blood counts or urine tests? More clues there.
definitely. A complete blood count, a CBC, might be normal. Or it could show signs of infection or inflammation, which might be contributing to the hyperglycemia or maybe a consequence of it.
Okay.
A biochemistry panel, well, that's where you'll see the elevated blood glucose. Sometimes that might be the only obvious abnormality at first.
And urine.
Urinalysis is really important. It might be normal, but often if the blood sugar's been high enough for long enough, you'll find glucose in the urine. Glucosuria.
Sugar spilling over.
Exactly. You might also see signs of a urinary tract infection, white blood cells, bacteria. UTIs are more common in diabetics.
It's okay.
Finding glucose in the urine, plus a high fasting blood glucose. That's a very strong indicator of diabetes mellitus. You might also find ketones in the urine.
Ketones, what are they?
They're byproducts the body makes when it starts breaking down fat for energy because it can't use glucose properly. Finding ketones is a sign things are getting more serious, potentially diabetic ketoacidosis.
Right, that sounds serious.
Yeah.
Are there any other specific tests to pinpoint the cause?
Yes, that fructosamine test gives the longer-term picture, as we said. And if the vet suspects an underlying hormonal issue is causing insulin resistance, like Cushing's.
They test for Cushing's.
Right. They might do specific tests like an ACTH simulation test or a low-dose dexamethasone suppression test to check for that. It's worth noting imaging like X-rays or ultrasound usually isn't for diagnosing hyperglycemia itself, but maybe for looking for underlying causes like pancreatitis or tumors.
Okay, that makes sense. So once a diagnosis is made, hyperglycemia is confirmed. What's the game plan? How do you get those levels back on track?
Treatment really depends on the cause and severity, but the mainstays generally involve insulin therapy.
Injections.
Yes, injections, very common in dogs and used in many cats too. Or sometimes oral medications that help lower blood sugar, typically an option for some cats with type 2 diabetes.
Okay.
And critically important, stop any medications that might be contributing to the high blood sugar. That's step 1 if a drug is involved.
Makes sense. And fluids.
If the pet needs IV fluids, it's absolutely crucial to use fluids without dextrose. Dextrose-free fluids only.
What about diet? How much does that play a role?
Oh, diet is huge. Really critical, especially for managing diabetes long term.
Different for cats and dogs, you mentioned.
Generally, yes. For diabetic cats, the recommendation is usually a diet high in protein and low in carbohydrates. Their metabolism seems to handle that better.
High protein, low carb for cats. Got it. Dogs.
For diabetic dogs, often a diet higher in soluble fiber and lower in fat is preferred. The fiber helps regulate blood sugar absorption, and lower fat can help with weight and pancreatitis risk.
High fiber, low fat for dogs.
Okay.
And specific medications. Our source mentioned different insulin types.
Yes, there are several. In emergencies, like that ketoacidosis we mentioned, a very fast-acting insulin called regular or crystalline insulin is often used first.
For immediate effect.
Right. For routine, day-to-day management in dogs, an intermediate-acting insulin like Lente, brand name Vetsolin, is common.
Okay.
In cats, longer-acting insulins often work better. Things like insulin glargine, Lentis, or PZI insulin, they provide more stable background control.
And oral meds for cats.
An example is glipizide. It works by stimulating the cat's pancreas to produce more insulin. It doesn't work for all diabetic cats, but it's an option for some.
Are there things you absolutely shouldn't do when treating hyperglycemia? Big no-nos.
Definitely. As we said, avoid any meds that raise blood glucose, like steroids, unless absolutely necessary and managed carefully by the vet.
Right.
Never give IV fluids with dextrose. And a big one, don't lower the blood glucose too quickly or too drastically with insulin. It can cause a dangerous drop, hypoglycemia, which can lead to seizures, coma, or even cause swelling in the brain, cerebral edema if the drop is too rapid, especially in very dehydrated patients. Gradual is key.
Gradual lowering. Okay. Our info also mentioned another medication, a carbose. How does that fit in?
A carbose. It works differently. It acts in the intestine and blocks the enzymes that break down starches into simple sugars.
So it slows down sugar absorption from food.
Exactly. By slowing down carbohydrate absorption, it can help reduce that big spike in blood glucose that often happens after a meal. It's sometimes used as an add-on therapy.
Interesting. So once the initial high blood sugar is under control, what does long-term management look like?
Long-term, it's really about monitoring. Carefully watching the pet for any return of those clinical signs, the drinking, urination, appetite changes.
Keeping an eye out.
Yep. If a drug causing the issue was stopped, blood glucose should be checked periodically to ensure it stays normal.
And for diabetics.
For ongoing diabetes management, vets often use those glycosylated hemoglobin, HbA1c, or fructosamine tests we talked about. They give that longer-term view of average blood sugar control, which is more useful than just single spot checks sometimes.
So monitoring those averages over weeks or months.
Precisely. It helps fine-tune the insulin dose or other treatments.
And what are some of the potential long-term problems if hyperglycemia isn't well managed?
Unfortunately, pets with chronic high blood sugar are definitely at increased risk of infections. UTIs, skin infections, dental disease.
Makes them more vulnerable.
It does. And as we discussed earlier, really severe uncontrolled hyperglycemia can lead to that dangerous hyperosmolar state, causing significant neurological problems, even coma, and things like cataracts in dogs, neuropathy in cats.
So definitely something to take seriously and manage consistently. Okay, so to sort of wrap this all up, our deep dive into hyperglycemia in cats and dogs really shows it's a super important sign, doesn't it? Often points to an underlying health issue, most commonly diabetes.
Absolutely, and recognizing those early warning signs, the thirst, the urination changes, weight loss despite good appetite, maybe that flat-footed stance in cats, it's just key.
Catching it early makes a difference.
A huge difference. And, as always, working closely with your veterinarian for an accurate diagnosis and getting a tailored treatment and management plan, that's the most important thing you can do for your pet's health.
Couldn't agree more.
And just to reiterate, all this valuable information comes directly from the medical sources we've been digging into today.
Right. So finally, here's something for you, the listener, to really consider. Take a moment. Think about your own Surrey companions. Have you noticed any subtle shifts? Maybe they're heading to the water bowl a bit more often lately, or perhaps seem just a touch more tired than usual. While lots of things can cause minor changes, sometimes these seemingly small observations, the things only you might notice, can be those very early clues to a bigger health issue that needs professional attention.
It really highlights your power as their owner, doesn't it? Being that careful observer.
It does. And the importance of those regular vet checkups, even when things seem fine, You know your pet best. Your proactive awareness, noticing those little things, can play such a vital role in their long-term health and happiness. Something to keep in mind.